amongst all the specialties, my specialty has the longest name. So technically it's otolaryngology head and neck surgery, which sounds pretty fancy. And I'm primarily a sinus surgeon. So, and you'll know this when you start to do your, if you do an ENT rotation, the head and neck surgeons really consider themselves to be like the surgeons, because they do the big cases and they do laryngectomies and they take this off and they put that, and they always laugh at the sinus surgeons because we're just always doing all this little stuff. So I was laughing because I love it when people say I'm a head and neck surgeon, because all of my head and neck surgeon colleagues are rolling their eyes. Thank you guys very much for coming out today. It really is a pleasure to be here, and I'm the 8th in our 151 years. I'm the 8th female president and the first female surgeon, so it's always a nice place to start to be a bit of a groundbreaker. And I always start by saying 20 years ago, when I was in medical school, or over 20 years ago, I never pictured myself being up here. I think the most sort of advanced leadership position I had in medical school was in first year, and my friend and I were the social organizing reps. You guys know what socials are, right? Okay. I asked that in Ottawa, no one had a clue what a social was. And so it was like first term, you know, we're new, we're keen, we thought, okay, we want to make a good impression. So we organized a social, but we really wanted to make sure we made some money, we didn't lose money. So we picked a hotel, which in retrospect was not the nicest hotel to have it in. It was a bit of a biker bar, which we didn't know until later. And not the nicest area of Winnipeg, but it was super cheap, and that was why. And then we thought, why serve food? You know, it will make more money if we don't have to buy food, so we didn't serve any platters. There was no food, which we found out later was illegal, but we did manage to make a little bit of money. Part of my reason to tell you that is because I think your generation is starting off with far more leadership training and skills than generations past. And it's always exciting to see each generation come forward with more knowledge and more skills than generations past. So I have nothing to disclose. And if you did happen to be at the CMA meeting in August, you would have seen this slide before. And it's one of my favorite slides to use because it grounds me and it tells you a little bit about who I am. My mother was a nurse, she's retired now, from the Philippines, and she raised me to be a strong and independent woman. My father was a physician from India, and that's how they met in Winnipeg at the then municipal hospital. And I'm an Osler through marriage. So Sir William was my husband's great-great-great uncle-in-law, and he is widely considered to be the father of modern medicine, introduced patient-centered care, and also served as the 17th president of the Canadian Medical Association. So I get to say I'm sort of the only, I think, president that's had sort of two kind of in the same family serve as presidents. And as physicians, we advocate for our patients every day. And it's through this experience and from the leadership training that you get. I see a lot more medical students wanting to become better advocates and better leaders. And so as you heard earlier, I did not start out my career thinking I would end up in this position. I did spend a number of years involved with my provincial medical association, Doctors Manitoba, and my last position there was chair of the Physician Health and Wellness Committee. But the CMA presidency rotates between the different provinces. And depending on how many members your province has, that's what determines how often your province gets a turn at the residency. So I'm not sure what it is for Alberta, but for Manitoba, for example, we get a turn about every I think it's 16 years. Ontario gets a turn every 4 to 5 years. So it was about September 2016, and I was at a meeting with a colleague from Doctors Manitoba, and we were talking about the meeting that was going to be in Winnipeg in 2018, because we knew the president would come from Manitoba and be installed at that meeting. But you have to spend a year as president-elect first, and there's going to be an election that winter in Manitoba to select the president-elect. And as we started to think about who was going to run, so-and-so going to do it, so-and-so going to do it, they turned to me and they said, why don't you do it, Gigi? You should run. I think you'd be great because of this, this, and this. And my initial response was, me? Who's going to vote for me? Why me? And in retrospect, it was a little bit of imposter syndrome and a little bit of not knowing that to be CMA president, all you had to be was a CMA member and get 10 people to sign your nomination form and be willing to run in the election. I had thought you had to be a past president of your medical association or at least on the board, which I wasn't. So I thought about it all night because the prospect of running terrified me and excited me. By the end of the morning, it excited me about that much more than terrified me, so I decided to run. And what excited me most about the possibility of running was to elevate a lot of the discussions I've been having with my colleagues from that provincial level to the national level. Physician health at that time was still something that you kind of talked about. There were certainly no national initiatives. Different provinces had physician health programs. We had just brought one into Manitoba. But I recognize that when you step into this role and when you have this platform, the opportunity to raise issues to that other level is probably the greatest you can have across the country. And so as CMA president, you will hear me talk about things like pharmacare or things that the association speaks out on. But we're also going to be talking about things you may not have heard us talk about before. Things like unmatched Canadian medical grads, national licensure, climate change, diversity and equity in medicine. And there's been a shift sort of in this communication that we have, and we are recognizing how important our voice is as a CMA and as physicians, and how important it is to be a voice not just for the profession, but for our patients and for the healthcare system. And what I've come to realize is how important and meaningful your voice is. Zohaib and Dr. Clark and I were talking outside earlier about how important the voice of medical students is and how particularly your voice provincially and CFMS's voice nationally is. You are the future physicians. And I truly believe your generation is going to be a generation of change makers because you're coming into practice with more leadership and advocacy skills than generations past. And so at the CMA, we are committed to strengthening the profession and strengthening our relationship with medical learners, our medical students and our residents, and engaging with you in a lot of our advocacy efforts. So we're doing it together and not alone. And our goal is to support physicians and all the physicians in training to advance the health of our patients and our healthcare system. And we do that by working with you, with our members, and more with our patients. And so some of the advocacy initiatives that I'm sure you've heard of, but really are important touch points for the CMA: physician health and wellness, equity and diversity in medicine, We are working on a new policy looking at our medical workforce. And it's not just about gender. There's this growing body of research that's showing how the more diverse our workforce is, the better the patient outcomes. We are also looking at Canada's physician workforce, and in particular some of the mismatches. So mismatches between number of medical students graduating and residency positions, mismatches between graduating residents and practice opportunities, and imbalances between the number of family doctors, specialists, and subspecialists that we're training. We're also exploring the possibility of virtual care and how virtual care could improve access to healthcare for many of our patients. And in particular, access for our marginalized patients, access for our patients that live in remote, rural, northern, or Indigenous communities. How many of you guys here have heard of the Ambassador Program? Okay, so the Ambassador Program is a program that provides an introduction to health policy and advocacy for medical students, residents, and physicians in the first 5 years of practice. The ambassadors learn about medical policy, connect with like-minded peers, meet and get mentorship from physician leaders. You receive funding and support to attend CMA events, and you also help provide us feedback into much of the policy work that we're doing. The goal of this program is to ensure that we are meeting your needs, the next generation of medical professionals. So if you're interested in the Ambassador Program, you can, where's Kate? Talk to Kate, she's got her hand up. It really is an incredible program, and we are always looking to involve medical students interested in policy, advocacy, and leadership. We also offer advocacy coaching sessions to interested medical students, residents, or physicians. And this program has a 5-step process for building an effective advocacy campaign. And it teaches participants how to apply that 5-step process to any advocacy idea that you're interested in. You can put in a request for training at any time. And if you are interested, and I think they do come out here to do the training program, but if you haven't heard of it and you're interested, you can email Grassroots or talk to Kate as well. There are other ways to get involved. If you go to cma.ca, we've got a new website. You can join the member voice group, and we have e-panels, which are very short surveys or questionnaires that come out maybe a couple times a year to ask questions about some of the work that we're doing. So for example, in the early fall, we had an e-panel asking participants if they would be interested in national licensure. And the results of that was overwhelmingly yes. So we've taken that feedback and really are looking at taking a bit of a leadership role in the country to look at what are the advantages and barriers to getting a single national medical license. We've got some community engagement platforms as well. If you have a policy that you'd like to put forward, you can submit it online as a member proposal. And the annual general meeting and health summit is held every year. This year it'll be in August in Toronto. And if you're interested, you can find out more information on the website or join the Ambassador Program, and then you might be able to get sent there free of charge. And so if I could leave you with one piece of advice, it's this. I look back to when I was asked to run for this position, and my initial response was, why me? And I've thought about it in the 2 years since, and I think the response should be, why not me? So if an opportunity comes your way, if sort of your initial response is, no, why me? Think instead, why not me? Think about what you would bring to the table and what your voice would add to the conversation.